Hi, it's Ninan from Leeds Frailty Education. What exactly is delirium? Most people think of delirium as a problem of acute confusion. In fact, most recent classifications of delirium think of delirium as more of a problem of attention and reduced awareness of the environment. What is attention? Well, attention is how you select relevant stimuli from the environment, focus and sustain your response to stimuli from the environment, and switch your activity to different stimuli depending on which is the most important stimulus going on at the moment. Now that sounds a bit complicated, so let me give you an example. So let's imagine I'm cooking. I'm concentrating on the task in front of me. Behind me, the kids are chatting and watching the TV. Whilst I know that there are those stimuli going on, I'm not paying attention to them right now because I'm focusing on the task in front of me, cooking. If, however, there was a new stimulus that I needed to respond to, I would switch my attention appropriately. In this case, the children start speaking to me and I need to switch my attention, which people with delirium might struggle with. When you're looking after patients, you might notice a problem of attention when you're talking to patients and they struggle to follow what you're saying, or they just drift off in conversation. Sometimes they might have rambling speech, and other times they might be very sleepy and maybe even hard to rouse. We can test attention at the bedside with a test like the month of the year backwards, which is in the 4AT. On the other hand, you can also see problems with attention and awareness in people who are hypervigilant, maybe overreacting to stimuli around them and being very restless or agitated. So, as well as a problem of attention and awareness, the patient must not be their normal selves. So typically, delirium has an acute onset and a fluctuating course. The problem tends to come on over hours to days, although it might sometimes last for weeks or even months in rare occasions. It's not unusual for people to fluctuate throughout the course of the day, so they might be better at one time of day than other times. That's not unusual. That's what happens in delirium. On top of that, there are other problems with cognition. Typically memory problems, sometimes orientation problems like we've discussed before. There might be a problem with language, so people might struggle to read or write or understand what's going on or speak. There might be a problem with visuospatial ability. So that's the ability to understand shapes or objects and their relations to one another. That can sometimes be tested by doing a test like the intersecting pentagons test that's in the MMSE, for example. There may also be a problem with perception, so people may hear or see things that aren't there or misinterpret stimuli. Importantly, the problem that people have with delirium isn't already explained by something that's going on with them. So, for example, it's not part of a pre-existing diagnosis like a Lewy body dementia. And it doesn't exist in the context of a coma. So if someone's persistently, extremely drowsy like they would be in a coma, that's different from being in a delirium. When you look for causes by doing a history, an exam and tests, typically you find multiple medical causes. So that could include illnesses like an infection, problems like constipation or dehydration, metabolic causes, alcohol intoxication or withdrawal, other drug intoxication or withdrawal, and typically, like I said, there's multiple causes going on. If you look at these, many of these features are included in the 4AT. So the 4AT asks whether there's a problem with attention, it asks whether there's an acute problem going on, it tests for things like AMT4 and asks you to consider whether there's been any hallucinations. So the other things you have to do to confirm a diagnosis of delirium is to think whether there are other pre-existing causes for what's going on and whether there are medical reasons why this person is the way they are at the moment. If you want to learn about delirium and other aspects of frailty, then check out our course at www.leedsfrailtyeducation.co.uk. We run a 2-day course with 12 RCP CPT points that's got excellent feedback from previous attendees. The website includes details of who the course might be suitable for, learning objectives that are covered on the course, and dates of upcoming courses. We hope to see you soon.